Okay, everyone. Today I am joined by Kyle Fortinsky, who is a gastroenterologist based out of Barrie, Ontario. Kyle, I really enjoyed our first conversation. I want to welcome you to the show, and I want to give you some time to just kick things off by give us a quick snapshot of who Kyle Fortinsky is, and we can take it from there.
Yeah, well, thanks for having me. It's I love your posts on LinkedIn, and that's what kind of got me interested in seeing another like-minded doctor thinking about really beyond MD, thinking about life outside of being a doctor. So I'm a gastroenterologist. I practice mostly full time. I say mostly because my startup now is taking up a lot more time. But I was always very interested, of course, in practicing medicine from a young age. But as I practiced medicine, I felt that so much of our day could be made more efficient and could be done better both for us, for our patients. And I think similar to some of my mentors who've gone into research and solving very complex diseases and helping with treatments, I think I became somewhat obsessed with not just practicing medicine but trying to improve it. And so that's really where the mindset came from. And so when I was in California doing a fellowship, I sort of got exposed to a new healthcare system in the US with new challenges, new considerations. And I think being away from the Canadian system, it gave me more perspective on medicine practices around the world. And I chose to do an MBA while I was there. And all put together gave me, I think, a unique perspective, both with sort of a business hat on and a doctor hat on, to say there are things that we're doing in medicine that just don't make sense, both from a work-life balance perspective, from a management perspective. I think I really get excited about not just helping each and every patient, just like you help every patient you read, image on, and I help every patient I see in my office or in an endoscopy, but we can sort of do good by enacting a lot more change on a broader level. And I think that's what gets me excited and keeps me up at night thinking about, and also up at night working on it.
Hey, I love that. Kyle, remind me, where did you do your fellowship in California?
UC Irvine.
UC Irvine. I was not far away. I always ask anyone who has a California connection. So I was in San Diego in 2015, so not far from there. But I love how you described your path. First of all, a very interesting path, and then you're taking pieces from there, and that has clearly shaped your outlook and how you would like to see medicine in your future. And now, maybe Kyle, just take us through Clever Consult. How did you come up with this idea, and really what pain point are you trying to solve here?
Yeah, so great question. So, I didn't come up with the idea on my own. It was really just a product of the experiences I had, residency, fellowship. I once worked with a well-known endocrinologist named Gary Lewis. I haven't even told him that this was sort of the stimulus. I probably should. But essentially, I went to do his clinic as a resident, and most of the job as an internal medicine resident going through a rotation would be you would see new consults, you would spend, probably an hour or two afterwards completing your notes. And I went into his clinic and he said to me, he goes, "Oh, just by the way, like my secretary already puts together like 80% of the note for you. So all of the past medical conditions, the medications, the allergies, all the things that you see in an internal medicine consultation note." I know you wouldn't know that as a radiologist, maybe, unless you open the.
Hey, I still go through the patient chart from time to time.
Well, that's amazing. Usually clinical correlation required is like
Yeah,
code
there's
for
none of that over here,
I
but
never
anyway.
I never open the chart. But yeah, so when I saw this, I was like, holy smokes. Like this doctor basically offloaded the task of doing this, significant amount of work, putting in labs and imaging results and all of the information ahead of time. And the experience in the clinic was amazing. It was amazing for me because as a resident, I wasn't then plagued with the unnecessary documentation. And throughout my residency, throughout my fellowship, I just kept thinking about this approach. And every time I did a clinic where I would see the doctors saying, "Oh, I got to go dictate my notes," or seeing the lengthy documentation they have to review and then type out or dictate. It always sort of sat uneasily with me to think that, why are we doing this? Like, why are we wasting so much time? It would be, the equivalent of a radiologist saying, why don't you, put the patient in the CT scanner yourself, inject the contrast, take the USB key and put it into the machine and then load it into your EMR. Like, it just seems like not a necessary task. And every doctor we know complains, I have such long wait times, my clinics run behind, I'm doing paperwork in the evening, doing wasting all this time doing sort of administrative work that burns us all out. Ultimately, that's what led me to developing Clever Consult. I saw some of the new technology like AI scribes that were listening into conversations and helping physicians save time in documentation. And I sort of felt that although that solution works great for primary care and for emergency, room physicians, and maybe for low documentation burden specialists, whether it's maybe orthopedics or dermatology, I thought, even if we had an AI scribe in Gary Lewis's office, like, you'd still have to say out loud all of the medications, all the medical conditions, all the labs. So essentially, I felt that we needed a program that actually worked for specialist workflows. And so what we've done is we've created an AI platform specifically for specialists, whereby it can read documents, it can administer questionnaires, it will take all that information, give you 80% of your note without having to do any work. And then when you speak to the patient, we'll add in the AI scribe to do the 20% extra. Ultimately, the goal is to save doctors time and for them to be able to spend time doing things that they actually want to do, whether it's more time outside of medicine, whether it's seeing more patients, whether it's spending better quality time with your patients because you don't have to rush through to finish the documentation. So it's a time saver, and I guess offloading tasks that I don't think should be done by a specialist doctor.
That really resonates with me. To summarize, Kyle, let's say somebody is an internal medicine specialist or a generalist in internal, and they get a consult that's going to come with a lot of paperwork. So my understanding is that your software will essentially take away those tedious tasks of synthesizing all that information, and it will automatically do it for the physician so that when it comes time to seeing the patient and then providing that consultation, all that unnecessary work behind the scenes in formulating a lot of that consult note is already done. Is that accurate?
Bingo. You said it better than me.
No. Okay. Now, who is your target audience? Is it internal medicine? Does it go beyond that?
Yeah, so we started with gastroenterology, one, because it's the best specialty, and two, because it happens to be my specialty, which I, obviously, if I'm going to make a product, I gotta help my own people out first. So we started with GI, and then we've moved into general surgery, rheumatology, and over the next sort of several months, we're going into oncology, we're going into palliative care, we're going into all the different internal medicine-based specialties, OB. So it's essentially going to roll out to different specialties, but the point being is that the current solutions, like people have heard of Heidi or Scribeberry or Mutuo, they're essentially one-size-fits-all solutions. So they'll say, oh, we're built for cardiologists, and oh, we're built for GPs, and oh, we're built for chiropractors and physiotherapists, but it's really everyone's using the same, everyone's drinking the same Kool-Aid. We're actually creating a customized solution for that specific doctor so that the output you get from Clever Consult, if you're a gastroenterologist, is going to look very different than if you're an oncologist. Maybe not on the drug allergies or the social history, but it will look different in terms of the types of medical conditions and the detail within those medical conditions that you actually want. It will look different in the type of labs and the type of imaging. So, when I look at an MRI and an endocrinologist looked at an MRI, they might care more about the adrenal changes, and I might care more about the pancreatic, biliary, or bowel changes. So we need to basically create a note that looks exactly like the note that physician would create on their own.
That makes a lot of sense to me. Now, you said there are AI scribes embedded within. So does that mean when somebody is seeing their patient, then they can use that scribe to complete the rest of the note. Is my understanding okay there?
Exactly. And it's funny, we
Okay.
started off saying we're not an AI scribe. We're doing this sort of pre-charting work the same way that I saw Gary Lewis and the same way I had done it in my own practice. And then we heard from so many of our users, well, we actually really like the scribe because you're only getting us 80% the way there. And, we don't just want the three-layer cake, we want icing and we want a cherry on top. So we're building the scribe because that's another value add, and we think will save our customers even more time.
Now, there's a lot of areas I liked within internal medicine when I was training. I did like gastroenterology, although I will say I probably enjoyed respirology more. I hope we can stay friends after I said that. And then rheumatology as well, because that just ties in with my area of interest in MSK. But that everything you've said really resonates with me. Now, in terms of medicine being what I believe is a universal language, I suspect that this could be of interest to people outside Canada. Is this a Canada only thing for now? And what are your thoughts on going beyond?
Yeah, so great question. I mean, I would use the same tagline where let's help our own people first. I think, it makes sense. I have a lot of colleagues and, people that I can reach out to for advice and for helping develop the products and create the products. So using our connections within Canada has been useful, but already we've seen a lot of interest and we're looking at launching soon into the US, into Australia, and probably the UK shortly thereafter, because essentially, like you said, medicine's universal. Language differences really are relevant in the age of AI because you can switch to different languages. And I think so long as people are practicing in a system that's somewhat fragmented, whereby information is being transferred from one doctor to another or one hospital to another, I think there's huge value in summarizing that information and creating a note. Whereas if you were in a closed system like a Kaiser Permanente in the US, as an example, closed hospital system where family doctors, specialists, hospitalists are all on Epic, some of these EMRs have the ability to do this in some ways already by auto-populating the labs and the medications and the imaging results, albeit not in as clean of a way as we can, but because they have the data all in-house, it's easier to do. We're trying to replicate that for physicians across the world that are gathering data from different sources.
Does your product embed within an EMR? And the reason I ask this is some people may wonder, well, I use a certain type of EMR. Would Clever Consult be compatible with that?
Yeah, so right now, because obviously, we're just building the product, it's hard to sort of integrate immediately with multiple EMRs. But the biggest EMR player right now in Canada for specialists is Accuro. And so we're in the process right now of becoming integrated with them. And then over time, the more sort of value we can add to our customers by integrating with various platforms, we'll continue to do so. Because the ideal, right, is that if you can have this sort of AI assistant where it does exactly what Gary Lewis had, or I've had in my office hiring individuals to do this task, is opening up your chart and having the note almost completely done. And there's probably some analogy to radiology whereby, and we can talk a little bit about this, is like, are radiologists going to be completely replaced by AI? And at least from my perspective, it's not about replacing, it's about enhancing. And so do I think radiologists, maybe not you because you're such an outstanding
Well,
radiologist that could be here, but it's like, could every single doctor and every professional and every person in the world be enhanced in some way with automations, with checks and balances, with, clever tools that assist us, not replacing us, but make us better? And I think that's really where the opportunity lies. And so I think products like this will actually make us better as opposed to replace us.
yeah, Kyle, there's a lot here. I think one theme that you are hitting on is finding ways to inject a little bit more joy within our work. And how we do that, I think, is we regain a little bit more control over how we use our time. For example, in radiology, there are certain tasks that I can't stand. If I have to dictate the same thing over and over and over, for me, that's where automation comes into play. And it's a shame. I really didn't harness the full potential of this before. But now that I have optimized my templates, for example, if there's like a fairly routine case of appendicitis, instead of dictating the entire thing, I can have a macro that has all of the pertinent positives and negatives, and I can tweak along the way, but it saves me a lot of time and it allows me to solve problems and mysteries, which is how I want to solve my time rather than talking all day into a dictaphone. So I think people should think about medicine this way and how they practice. Eliminate the stuff you hate so you can focus your time more on the things that you truly enjoy. That's how I try to think about it. Now, Kyle, I do want to ask you, the people who have been using Clever Consult, maybe just take us through their experience in a given week or a given month. How much time can they potentially save? Because I talk about time a lot on this podcast, it being our most precious resource.
For sure. And I agree with everything you said with regards to doing things we like to do and optimizing our time. With regards to how much people are saving with Clever Consult, it really depends on the practice. I think for the most part, customers will say on average 2 to 3 hours a week or more. For me personally, I could tell you I had a day of endoscopy yesterday. Obviously, as the co-founder, of course, I'm using Clever Consult, and it saved me in that one day about an hour on documentation, and that's a conservative estimate. There's various factors, nuances. In medicine, nothing's ever 100%, but it's a considerable time savings. But what I would say is that, like macros that you're finding useful, every doctor to some extent figures out what works best for them. So I think, although I'm creating this solution that I think is, incredible and it works well for clearly like hundreds of specialists across the country, and I hope many more, like every doctor I think is going to have to sort of decide and play around with various instruments, various tools to see what works in their workflow, right? Like, based on what you're saying, every radiologist, it's a no-brainer. They should be using macros, but are they all using macros?
No, some people, and for a while, I still dictated freestyle because I thought, here's my chance to tell my story. And I tried to make things a little bit more fun that way. But you're right. You have to find out through trial and error what works best for you. And it's not going to be the same for people across the board. I totally agree with that.
Well, the story that you're able to tell now through your podcast is much more interesting than the story you wanted to tell in your radiology reports. So
That's why I keep doing the podcast, because the podcast is certainly something that lifts me up, the chance to have these conversations. So you're right. Now, Kyle, I know you've been talking to our colleagues about Clever Consult, what it can offer, and you've probably got a lot of feedback along the way. And I'm wondering if you can share some of the feedback that you've gotten to date.
Yeah, so this is probably the most enjoyable part of the late nights and the weekends and the time away from my family, which is ironic because the whole reason I'm trying to save people's time is so that we can spend more time with our family and friends. But in building this, I'm actually inadvertently sometimes spending less time with them. But the feedback really is kind of what you were alluding to. It's, wow, I can't believe I was doing without this before. One of our I love what he said, is that he said he used to spend about 2 hours a night sort of prepping his notes for the next day's clinic. And he says, now I can spend 5 minutes sending all of the notes into Clever Consult. I take my dog for a walk for like an hour and a half. I come back and it's all done for me. And that's like, couldn't sort of, I guess, summarize what I want the value to be, is that the time that we're spending doing unnecessary sort of administrative work is the time that we should get back. I'm all for spending lots of time with our patients. And sometimes people who haven't used the product, I just gave a talk last night in London, and some people said, well, if you just get AI to do all this, like, are you even going to talk to your patients? And they said, well, if you have all this information, what are you going to talk to about your patients? And I kind of responded, well, you'll talk to them about what they're actually there for.
Exactly.
And that's been my experience, and a lot of my customers are saying the same thing, that instead of these medical visits that are interrogations, what medications are you on? What allergies do you have? Do you smoke? Do you drink? Did you do blood work? Did you do an ultrasound? When did you have a scope? You can get into more of a discussion. And as much as we say sort of patient-centered care, I think so much of our time, because it's constrained, is spent on gathering information and providing sort of a consultation based on that information gathering. I think the quicker we can get that information gathering out of the way, the quicker we can provide good care. And the perfect example, and again, this is what one of our early customers also said, is that the easiest consult to do is to see, let's say, my colleague who's a gastroenterologist. I just did a consult 2 days ago, and now they're coming to see for a separate issue, but everything's already been laid out for them and everything's there, so they understand exactly what's going on, and they can just actually focus on their role in what they're trying to achieve. And they said that's essentially what Clever Consult does for them each and every time. It just gives them the framework so that they can spend less time on this sort of information gathering and compiling stage, and more on actually looking after your patients. And I think that's been the most common sort of theme. And that's why I'm so passionate about trying to bring this out to more and more specialists, and hopefully give us some of our time and hopefully our enjoyment, back into medicine.
I love that topic of finding more joy at work. Kyle, I want to ask you now, because let's pivot into your journey in creating this and some of the lessons you've learned along the way. Last time we talked, we were talking both about our young families, and you just mentioned that you essentially work full time, and now to be building something on the side, that's got to be quite the undertaking. So maybe just take us through your thoughts and your journey of diving into this head on. Talk to us about committing to this and what this whole process has been like.
Yeah, I mean, I would say it's not exactly how I drew it up, in the sense that, I did my fellowship, I did an MBA, I always had interest in business. And I remember even in my first few years in practice, just sort of getting my feet on the ground, especially in therapeutic endoscopy, where my biggest stress was, doing these complicated procedures, avoiding complications, looking after my patients before and after. It was more than enough on my plate. I didn't have time for anything else, not to mention having 3 kids along the way. But I remember my mother-in-law saying, Kyle, I think you were going to do something in business, and, I'm a bit surprised that you haven't sort of, done something. I saw you as an entrepreneur. And my response would be like, I have 3 kids, aka I made you 3 beautiful grandkids. I'm working full time. I'm, managing my group's practice. I'm partnering in this private endoscopy. I don't have time to do anything else. And I think what happened with Clever Consult is that, it was sort of a collection of, again, all these experiences I had, what I actually felt practicing medicine for several years inside of the system, understanding that we're all overburdened. We all have too many patients. We all get way more referrals than we can look after. We're all, have offices that are bursting at the seams with not enough place to put our patients. And we need to find a way, aside from just, again, hiring way more doctors and building more hospitals, which probably needs to happen as well, but we need to optimize the people that are already there. So, it just became such a obvious problem that I think we could solve fairly easily by leveraging AI. And so it honestly fell into my lap. And I would say, in this sort of, strictest term, I just became sort of obsessed with solving this problem. And even though I'm working harder than I've ever worked in residency, fellowship, doing my MBA, in practice, 3 young kids, I'm working harder now than I've ever worked, but I feel more energized than I've ever felt, because I feel like I'm working on something where, back to what my customers are saying and early users is we're making a difference in their lives. Of course, as a doctor, we make difference in lots of people's lives. As a dad, as a husband, I make hopefully a really nice difference in my kids' lives. But I think I felt that there was a unique moment in time where AI is coming to the forefront, where medicine is starting to be receptive to making changes because I think we don't have a choice. And so I was kind of like, you know what, in an ideal world, I would start this company in 10 years from now when my kids are older and I'm much more developed into practice. But I think the opportunity will be gone. So I felt like I had to seize the moment. I still feel that way. And so, just yesterday, I woke up at 6 in the morning, drove to Barrie, scoped 15 patients, drove after work all the way to London, Ontario, gave a talk to a bunch of doctors, drove home, and then started my clinic at 7:30 this morning. So that's just in my last 24 hours, but I don't feel exhausted and burnt out. I feel energized, and it's an amazing feeling. And I think, to your point, with your podcast and with a lot of the ways that you view medicine, I think we see things similarly, is that sometimes doing more actually makes you feel, more fulfilled, more energized, more relaxed. Sometimes the work-life balance isn't always about, less work and more life. Sometimes it's about shifting the type of work you're doing. And I think shifting where you're spending your time, not simply like taking vacation more or ending my day a bit earlier. That's, to me, wasn't as rewarding in terms of a work-life balance than actually doing other things that are stimulating.
That's really well said. I am curious though, are there certain commitments that you just had to let go of to make room for this?
I mean, I would say the only again, like, I was fortunate that at this time where I was building the company, my gastroenterology group was growing. So I was going from 1 in 5 call, so 1 week in every 5 weeks being on call, to 1 week in every 8 weeks being on call. And we've had a couple new gastroenterologists join our team. So I've been able to manage my practice because we've had new joiners that are able to share some of this clinical load. So I would say that because of that, it's afforded me the ability to take a little bit more time away than I would have been able to. Again, with regards to my family, certainly there's certain things when I'm traveling out west and away for a week, I'm sacrificing some time with them. But my hope is that, as we continue to build this, that ultimately not just me, but all doctors will actually be able to be just as efficient and just as thorough and, great doctors, but not be, as reliant on their time as they were previously. It's a little bit of, sacrifice now, but the hope is that the dividends will pay off, not just for me,
sure.
but for all my colleagues. So I feel like it's worth it, but it's always a balance.
You said you did your MBA. Would you say the knowledge that you got in your MBA, has it been useful in the journey that you decided to pay for yourself here?
For sure. I was a typical sort of sciencey type of guy who always had some interest in business, but I'm sure, as you remember, it's like, it doesn't feel like that long ago, but it was about 20 years ago where I went to university. I took all science courses. I never took a business course in my life. And I think that one blind spot for doctors, and people love to say, and even now that I'm an entrepreneur, people love to always say, I can't believe you're an entrepreneur. Doctors are so bad at business, and doctors are, they're not good businessmen, and they don't know what they're doing. And, obviously it's a way overgeneralization, because I can name tons of doctors that have been immensely successful, but it's not our focus, So we learn to study, sciences. We learn to use evidence-based. We learn to work really hard and get results, and business isn't as linear. So I think the thing that the MBA helped me with was the fact that, as a first foray into the business world, it was about understanding that, you need to take chances. There are risks. You need to figure out, what your risk adjusted return is. You have to figure out, what the strategy is. And no matter how much you study or no matter how much you work, it doesn't always necessarily work in a linear fashion. So I think in medicine, we don't take a lot of risks. We're not supposed to. But I think in business, you have to. So, I think it's more about just the mindset. I don't think, for doctors out there, that are listening, I don't necessarily think an MBA, you need to spend years to do an MBA to start a business. I think you can start one without one, but you need to change the mindset that we go into every day, which is a very sort of linear mindset with a more creative mindset. And I think that's actually, to me, what's the most stimulating. So that's where the MBA helped, is just sort of to change my mindset. And without that, I certainly wouldn't have had as much sort of ability to do this. And, my co-founder is also an MBA, and he has a lot more business experience than me. So, this is certainly not something that I've created by myself by any means. And so I think, again, an MBA teaches you to work well in a team. And I think I've chosen a real amazing team between our developers and my co-founder. And that's really sort of way more important than the sort of lectures I took in my MBA.
On this journey of you guys creating Clever Consult, is there anything that happened along the way, Kyle, where you just said, wow, we really should have done things differently? Was there anything that hit you? And if you could go back and do things again, was there anything major you learned in the process?
Nothing. No, I'm joking. It's like literally every day. It's like, we should have done this differently. Oh, why did I say this? I was completely wrong. It's completely, like, I wouldn't say we've made any major errors or any things that I'm like, oh, we totally screwed this up. But what I would say is, what I like to think, and it's probably true of a lot of things in life, is there's a book called Lean Startup, and it really talks about not creating an idea and not creating a product or a business in a box, sort of in your head. And then once you've created this perfect product, release it to the world and say, hey, don't you love my product? And I think old me, prior to MBA, prior to Lean Startup, prior to having such a great partner who's really a very well accomplished businessman working alongside me, it was like my intention that I'm going to make this perfect product that's going to be amazing, and then as soon as people see it, they're going to say, oh my God, this is incredible. And that was what I had in my head, like, oh, I'm never going to put this out until it's great. But what I learned along the way, and where it ties into your question, is we wouldn't have figured out like all of the things that we were doing that were totally wrong. And so the fact that we release things, and I thank a lot of our early customers for being patient with us and giving us feedback, is that you actually need to make mistakes and you need to learn from those mistakes to make it better. So that's like in medicine, it's somewhat similar, is that you can't come out and be a radiologist and say, I've never once missed, an appendicitis. I've never once missed, this subtle finding because I didn't become a radiologist until I knew that I was 100% perfect. It's like, no, you have to miss things, because then you sort of train yourself and say, well, why did I miss things? Why did I miss that? How can I fix this next time? So I think the biggest lesson we learned is that let people give you feedback, make mistakes, and just don't make too big of a mistake that you can't fix. And I think that's probably true in most of our lives, is, and we do that with our children all the time, is, they say, let your kid trip, let your kid fall, they'll learn to get back up. Don't, prevent them from falling. And so we've made a ton of mistakes. I had so many ideas of what I thought Clever Consult should do and the type of, pathway. And then even though I'm the co-founder, I'm only one customer. So learning from our other customers has sort of highlighted for me so many things that we could do better. And that's why it's fun, because it's a work in progress. And, I had a couple people at my talk last night telling me this they don't like and that they don't like, and, various aspects. And that's what you want, because then you can actually go somewhere in terms of improving it.
That's really well said, Kyle. What's the biggest thing you learned about yourself in this process? I believe that when we do things that are difficult and we push ourselves to the edge of our comfort zone and beyond, that's when we really start to learn about what we're made of. What did you learn about yourself?
That I love solving problems, and I'm actually, I think, thriving in the unknown. And, again, it ties a little bit back to people ask me sometimes why I wanted to be a doctor. And I said, well, when I was a kid, I wanted to be a doctor. And I always said that. And of course there was like, well, it's a noble profession. We get to help people. It's rewarding. But I think there was something in medicine that was like, if you work hard, you're going to be successful, and you have this guaranteed path, which I'm living right now, where you can have a house and you can have vacations and you can afford, you're not living in the lap of luxury, but it's a linear path. You work hard, you gain success. It feels like it's fair, for most of us. Apologies to those, maybe who don't feel their compensation is fair, or there's other factors in their job. But in general, you work hard, you get it. I think there's something in business that's very interesting, and it's inspiring because it is humbling. Like, doesn't matter how hard you work necessarily. It helps to work hard, but you may spend the most amount of time building a marketing, approach, and it just totally fails. If you worked harder on it, you would have never achieved better results. You literally needed to release something, iterate, fix it, make it better, and that's how you learn. So to me, the thing I've learned about myself is I'm actually enjoying that process of not being 100% sure of what if something's going to work, and sort of living in that moment of let's see what happens and move on, which is something I think is what's driving me. That's different in business versus medicine, is just you can be a little bit more creative, you can take more risk, and the sort of, although it's counterintuitive, the fact that you're not guaranteed a result no matter how much harder you work is inspiring.
You got a great outlook to think about it that way. Kyle, I want to ask you, I'm sure you've given some thought to this, but you're working quite a bit right now clinically, but down the road, do you have a vision of what your ideal life looks like when it comes to balancing clinical practice and the business? Do you know what that breakdown might look like down the road?
Yeah, I mean, so it's sort of, I'd be remiss if I don't mention my dad, but my dad was a lawyer, but he was like, if you asked him what he was a father, and on the side he did law. I think one of the things I don't like about medicine, and I'm sure we can all relate to this, is I don't like the fact that certain situations I will not be able to be there for my kids the way my dad was. So if my young son, who's 1.5 years old now, who has a basketball game and I'm on call and I can't make it, that's like, to me, is going to be very troubling. So to me, the ideal job description is being able to practice medicine, which I love doing, but more on a sort of reduced basis, maybe a part-time, a practice share, like a lot of my colleagues are going into, and my business on the side, and hopefully working on Clever Consult or other endeavors will afford me sort of the stimulation in terms of creativity and opportunity, but also in terms of just flexibility. I think that being flexible for me and putting in the time now, knowing that my oldest is grade 1, in the next 3, 4, 5 years, like I don't want to ever have to not be there for an event. And I think anything that gives me a little bit more flexibility, I might be working late at night, or I may be having to travel from time to time, but I think on a day-to-day basis, I'll have more flexibility with my time to be with my family. That's ultimately my goal.
That's a great goal. It's a great goal, Kyle, because I could tell you it's a beautiful age that your kids are at. This is really a golden window, and I think you're thinking the right way about it to go and make the most of this time. I really do. I want to wrap things up with, let's say, somebody out there listening is maybe considering starting something. They have an idea. What is your general advice to that person? And then, Kyle, of course, any closing thoughts that you want to leave people with too?
Yeah, I feel like I've said everything. I said lots of things I've never even thought about before. So
Yeah, that's good. That was the intention.
but yeah, I mean, I think anyone thinking of starting a business, I guess the first question I would say to them is it the right time? And by that I mean, is it the right time in your life? Is it the right time for the business? And, those all have to factor in. For me, I would say probably sort of the right time, 5 or 6 years into practice, not really the right time with such young kids, but at the same time, the right time for the business because it's AI. And I think if I miss this opportunity, it's not going to afford itself later on. But I think that's an important question because as doctors, there's going to be lots of ebbs and flows in our career. Early on, you're starting your practice is not the right time to be starting a business. It's too much. It's too much of a I think you're going to do a disservice to yourself as a physician by trying to take on too much early. That being said, like the most important decision in a business is who you partner with. And for me, I think one of the ways that I would say any doctor can sort of get involved in a business is find a friend, find a colleague, find somebody who's maybe trying to start something or has a similar idea, and be with somebody that's done this before, right? Like I think businesses in general take a lot more than desire and intelligence and work ethic. I think you need some people to actually guide you along the way. And for me, I've been very fortunate to partner with one of my very close friends who had a very strong business background. We were then found a very strong developer who helped us. And so I guess I'm reframing the question to say, when we're thinking of starting a business, the first thing to think about is who are you going to bring on your team? Because your team, especially if you're a practicing doctor, right? Your team is the one that's really who you're going to have to lean on. And it's no different than if you said, what's the most important decision I've made in my life? Choosing my wife, right? Or convincing her to choose me. But it's like there's nothing more important than that decision about who you partner with. And I think especially as a doctor where your time is, again, somewhat restricted, especially early on in a business, it's finding the right team. So don't do it alone. That's the number one thing. Make sure it's a good time and find somebody that you can trust and that ideally, has done something before to help guide you. Because as doctors, we have a backstop. So I always say, that even if my company doesn't work out, well, I won't be homeless. I can still put food on the table for my family. Some people see that as a weakness because some entrepreneurs, they have their back against the wall. They are going to live or die if the business succeeds. We don't have that type of, I think, restriction, but I think, we have to choose the right team around us and only do it if it's going to make you happy. And that's where me and
that's
you
so
agree.
important.
That's when me and you agree on things. Like it's very cliche, and to, potential investors and stuff, of course, I want the business to be successful and I want it to make a lot of money. But number one goal for me is to make myself happy and to, I think by being able to help other doctors and improve what I think is a bit of a broken system, that makes me genuinely happy, and that's worth more than anything else.
I think you've got a great reason for doing this, Kyle. Thank you for coming on the show and spending time with us today. And I really like the pain point that you are trying to solve for our community. So I think there's something in this episode for everybody. And I really look forward to our next conversation.
Perfect. And thanks, Jan, for having me and for
It's a pleasure, man.
For asking all these questions. And also I want to thank you just for being, such a nice, refreshing voice in the medical world. Sometimes I think, work-life balance and, talks about being happy and doing things that we love, I think is a new generation in doctors' lingo. I think it wasn't a popular conversation for the generation above us. And I think leaders like you doing a podcast, posting, is like every time I read it, you literally are inspiring me to do this more. So it's
Thanks,
not
man.
only from within, but I think so many doctors will benefit from seeing people like you and hopefully like me chasing their dreams and trying to find happiness within medicine.
Kyle, that means a lot to me. I really appreciate that. Appreciate your support along the way. And yeah, I think you're on to something here. And I want to wish you and your team ongoing success with this. I really look forward to seeing where this goes.
Me too. Thanks. Thanks
Okay.
so much.
Yeah, yeah. Take care.
Talk to you soon.